Welcome to PH Insights, presented by the Pulmonary Hypertension Association. Join us as we delve into patient stories, healthcare updates, and the latest insights on pulmonary hypertension. Hi, my name is Angela, and welcome to Filling in the Blanks, Understanding Pulmonary Hypertension, Part 2. Now, this episode is going to be a little bit different. We'll hear from Monica Penaranda, who is a member of the Pulmonary Hypertension Association's Board of Trustees, as well as a support group leader in California. In this episode, we'll focus more on pulmonary arterial hypertension, or PAH. Previously, in the first episode, we learned that PAH happens when arteries in the lungs become narrow or stiff, and the right side of the heart works hard to push blood through those narrow arteries. We also discussed how PAH can either be idiopathic, which occurs without a clear cause, or heritable, which can be linked to inherited genes from family members. And while there is no cure known for PAH, there are some treatment options available. So please, if you haven't already done so, and if you have a moment, go back and listen to Filling in the Blanks Part 1, and then come back and listen to this episode where we'll hear from Monica. Dr. Yang will also join us and give us a little bit of insight on the unique diagnosis that Monica experienced. So, Monica, if you would take a moment, can you please share your journey with us?
Hi, I'm Monica Penaranda. I have had pulmonary arterial hypertension for 27 years. It all started when I was 16 years old. I was still in high school, and I became pregnant. It was a pretty big disappointment to my family, but they didn't have much time to sit in that disappointment because I got incredibly ill. I couldn't even roll over in bed without gasping for air. My voice became a whisper because I had no sound anymore. I was extremely sick. I went to the doctor, of course. They ran many tests, and that was the first time I heard the words pulmonary hypertension. The doctor told me that they had never seen both mom and baby live with this diagnosis. 27 years ago, they just didn't have enough information to be able to treat both baby and I. So I thought in my 16-year-old mind that if I could just make it to 5th or 6th months being pregnant, that maybe they could save my baby with medical technology. They say that in time things get easier, but I can tell you that my baby would be 26 years old, and that there's not a day that I don't wonder what he would have become. That was the beginning of my fight to survive. So I was transferred to a small community hospital where everything happened. And that hospital is where they told my parents, "We are sorry, but there's nothing more we can do for your daughter. She's going to die." So there was a visual, lots of prayer. And one doctor happened to attend a seminar where my current doctor, Dr. Shelley Shapiro from UCLA, had spoken about pulmonary hypertension. So he knew just enough to pick up the phone and call her. And over the phone, this small community hospital was able to stabilize me just enough to get me into an ambulance and take me to UCLA. So when I was transferred to UCLA, I immediately had a right heart cath, and pretty much within hours, I had a central line put into my chest. But I was alive, and I tried my darndest to live a normal life. I went back to high school, finished my senior year, and I graduated and proceeded to work and try to live normal. Now, I will tell you, those years were not easy because I tried very hard to be a normal teenage girl with no health issues and no limitations. And that was not how my life truly was. So I often passed out. I often pushed my limits to the point where people were calling 911 because Monica's on the floor somewhere and they think I died. And my friends were dramatic. But through the years and with time and with maturity, I learned to take my medications correctly. I learned where my limitations were. I learned to go to bed at a good time, get rest, and eat well. And I did that. Looking back, I think, wow, I just played with my life. But I tried really hard to, and the difficulties of living with pulmonary hypertension and being a teenage girl, I I learned the hard way, I will say. But I also gave myself grace because I learned that there were things that I just couldn't do. I wanted to do it. My mind wanted to do it. My heart wanted to do it. But my physical heart was saying no. And my body was telling me, slow down. So I did learn to pace myself and manage my time. And I think that's when I started finding my new normal. And I'm just so blessed to be able to say that I'm still here 27 years later. I think being able to overcome the limitations that people put on this disease and say, no, I'm going to keep trying. I'm going to move up beyond this. I'm going to choose life. I think that was how I was able to live as normal as I can and choose life with joy. I think that's important.
Wow, Monica, thank you so much for sharing your journey with us. I I really appreciate you being very transparent with your experience. Dr. Yang, is this unique? This diagnosis through pregnancy? Can you share a little bit about your thoughts for Monica's journey?
It's not uncommon that we've seen pregnancy, like, unmasked diagnoses of PAH, and it's because during pregnancy, there's the body has all these goes through all these changes to accommodate the baby, and it involves sort of increasing the cardiac output, the heart has to work a little bit harder, there's more volume of just body fluid, so if normally the heart can accommodate that without any issues, but if the pulmonary arteries are already predisposed to being a little bit stiffer and thicker, then at it's typically we see it at around like 20 to 28 weeks or so. Essentially the body can go through like heart failure because it just
Mm.
isn't able to accommodate all those changes. And so we've had several patients be diagnosed during pregnancy
Oh,
with
wow.
PAH. And it's always scary, because at that point, they're sort of late stage in their pregnancy. So it ends up being sort of trying to manage them through those last couple weeks of their pregnancy with PAH and then coming up with a delivery plan
Mm.
with our OBGYN and anesthesia colleagues to try and sort of get them through that. But I think it's not uncommon because of the changes that the body goes through during pregnancy that
Okay.
PAH can be unmasked.
Wow. I think that is for Monica, obviously a blessing to uncover, during that time, and now she's here living 27 years. I
Yeah.
think that's really a testament to her team and then also her will to fight through this and learn and grow as treatment options advance. Thank you so much. And thank you for lending your expertise to us. And thank you for listening to PH Insights presented by the Pulmonary Hypertension Association. Remember to subscribe and to join us every second and fourth Wednesday of the month for more valuable insight. Bye, y'all. Thank you for listening to this episode of PH Insights. We'd like to take a moment to thank our sponsors for their support of the PHA Connects program, which brings you the PH Insights podcast. Sponsors do not participate in the development of and do not endorse content of programming. For a list of our sponsors for 2024, please visit our website at phassociation.org/aboutph/sponsors. Thank you for listening.